Substance use disorders, an introduction. Introduction. Substance use disorders, SUDs, represent a complex and chronic medical condition characterized by the harmful use of substances, including alcohol and illicit drugs. This essay aims to provide a comprehensive understanding of substance use disorders, exploring their etiology, prevalence, risk factors, clinical manifestations, and evidence-based treatment approaches. Definition and classification. Substance use disorders are defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, as a cluster of cognitive, behavioral, and physiological symptoms indicating that an individual continues using a substance despite significant substance-related problems. The DSM-5 categorizes substances into different classes, including alcohol, cannabis, stimulants, hallucinogens, opioids, and others. 2. Epidemiology. The prevalence of substance use disorders is a global concern, impacting individuals across diverse demographics. Factors such as age, gender, socioeconomic status, and geographical location contribute to variations in prevalence rates. Understanding the epidemiology of SUDs is crucial for developing targeted prevention and intervention strategies. 3. Etiology. The development of substance use disorders is multifaceted, involving a combination of genetic, environmental, and psychological factors. Genetic predisposition, exposure to trauma, early life stressors, mental health disorders, and social influences all play significant roles in the initiation and maintenance of substance use. 4. Risk factors. Certain individuals are more vulnerable to developing SUDs due to specific risk factors. These may include a family history of substance use, a history of trauma, coexisting mental health disorders, peer pressure, and a lack of family or social support. Recognizing these risk factors is essential for early identification and targeted prevention efforts. The clinical manifestations. Substance use disorders manifest in various ways, affecting physical, psychological, and social aspects of an individual's life. Symptoms may include tolerance, withdrawal, unsuccessful attempts to quit, continued use despite negative consequences, and neglect of other life responsibilities. The impact on mental health, relationships, and overall well-being underscores the severity of the disorder. 6. Treatment approaches. Effectively managing substance use disorders requires a comprehensive and individualized approach. Treatment modalities encompass behavioral therapies, pharmacotherapy, and support from mental health professionals. Cognitive behavioral therapy, motivational enhancement therapy, and contingency management are among the evidence-based interventions. Medications such as methadone, buprenorphine, naltrexone, and acamprosate can also be integral components of treatment plans. 7. Prevention. Preventing substance use disorders involves a combination of universal, selective, and indicated strategies. Public health initiatives, educational programs, and community interventions aim to reduce risk factors and enhance protective factors. Early identification of at-risk individuals and timely interventions are crucial in preventing the progression of substance use to a full-blown disorder. Conclusion. Substance use disorders pose significant challenges to individuals, families, and societies at large. A comprehensive understanding of the etiology, risk factors, clinical manifestations, and evidence-based treatment approaches is vital for healthcare professionals, policymakers, and the general public. By addressing substance use disorders from a multidimensional perspective, we can contribute to more effective prevention, intervention, and support for individuals struggling with these complex medical conditions.